So we're just trying to look at the application of biochemical testings in pregnancy. Okay, biochemical testings in pregnancy. So if I want to see if somebody has some one or two complications in pregnancy, what are the things I will look out for? Do you understand? So for monitoring of pregnancy complications using biochemical parameters, so pregnancy may be associated with what? Other medical complications, okay, and may require close monitoring and evaluation by biochemical testings. Do you understand? For example, diabetes mellitus. If I'm suspecting that a woman has diabetes mellitus, I'll always monitor her blood glucose to see the blood sugar levels. Do you understand? I'll monitor the glycated hemoglobin. Of course, this will help me know the amount of glucose that is binding to hemoglobin. You understand? Also, glycated albumin. If I'm suspecting that she has renal issues, I might want to access for renal function starting with urinalysis. So I want to see if she's passing out proteins in urine. That's proteinuria. If she's passing out glucose in urine, that's glycosuria. If she's passing out blood in urine, that's what hematuria. You understand? Then overall, I'll still monitor how her body is just clearing all those waste products, urea, creatinine, uric acid. Okay, just monitor how her body is clearing that. Then ectopic pregnancy. This is where a fertilized egg is implanting in a place that it's not supposed to be at. So in normal intrauterine pregnancy, during the 2nd to 5th week, the human coronary gonadotropin levels will double. Okay, so in ectopic pregnancy or spontaneous abortions, the levels are rising, okay, more slowly, or often even decrease. You understand? Progesterone levels will also be low, okay, and all. You get? So in preeclampsia, that's basically like a hypertensive condition of the pregnancy. Usually starts after 20 weeks of being pregnant. Okay, if you check for alpha fetoprotein levels, is normal. Now this is because alpha fetoproteins are usually what? Associated with all those chromosomal abnormalities, gestation, all those congenital anomalies. All right. So human coronary gonadotropin levels will be elevated. Unconjugated estradiol will be elevated. Other findings, you can see that maybe the woman is passing out what? Proteins in urine. Her blood pressure is increased. There's like accumulation of fluid, okay, in the lower extremities and all. So other biochemical findings, you see that her urea levels are high, creatinine levels are high, uric acid is high. This is because the kidneys are not functioning optimally like they should. You understand? The preeclampsia is like just hypertension issues. While eclampsia now, you're having seizures too. You understand? So it's a more severe form of preeclampsia. You are having an additional seizures. Okay, so you see that her serum, urea, and creatinine is rising very well. This is because kidneys functions are declining so much. All right. Then folic creatine clearance. Okay, proteinuria. That she's passing out a lot of what? Proteins in urine. Okay. Then I think basically there's a declining liver function test. You can have the HELP syndrome coming in. That's hemolysis, elevated liver enzymes, low platelets. Then gestational diabetes mellitus. There's usually insulin resistance. You understand? So for you to know that this is basically a gestational issue. All right. Once a woman gives birth, all right, every insulin issue starts to like resolve on its own. You get? So this is just how we can actually use biochemical parameters to know if a woman is having a possible pregnancy complication.